topic for discussion is Avitaminosis. As we all know, vitamins are one of the essential micronutrients that are required by the body, and these vitamins are grossly divided into fat-soluble vitamins and water-soluble vitamins. And in fat-soluble vitamins, as we all know, we have A, D, E, K, and in the water-soluble vitamins, we have vitamin B and vitamin C. Vitamin B is actually a complex which includes from B to 12. Okay. And any deficiency in these vitamins, as we know, each of these vitamin has a particular role in our body. You know, they have, for example, vitamin C is essential for collagen synthesis. Vitamin B has various roles in maintaining the homeostasis of the body. And when we are talking about these vitamins, when they are not taken in the required dietary allowances, then this will lead to avitaminosis. Any deficiency in these vitamins which are actually required by the body will lead to condition called as avitaminosis. So the topic for discussion now is avitaminosis, and let us see various avitaminosis related disorders which are actually sequelae of these deficient vitamins. So as to introduce these vitamins, as we all know, I'll not go much into introduction because we know we have already read about vitamins. I'll stick to avitaminosis in this presentation. Now, as we all know, vitamins are organic substances, and as we discussed, they are fat soluble and water soluble vitamins, and any vitamin deficiency disorders are usually more commonly seen in developing countries, in rural areas, in patients who are and people who are not fortunate enough to have good food in their life, that is well balanced diet. To say they're not having this balanced diet in the daily intake, then these patients usually land up with vitamin deficiencies. And we also can see various vitamin deficiencies like vitamin B, vitamin D and vitamin C in patients who are chronic alcohol and even in aged people, that is an older age group people. And vitamin D deficiency is more common in areas where there is less amount of sun exposure, who actually cover the whole body and they don't get enough of exposure to the sun. They also will have this vitamin D deficiency. Pregnancy and lactation, usually the RDA is more in these conditions. If there is no increased dietary intake as per the increased dietary requirement, then they also will land up with deficiencies of various vitamins. We also have deficiency of fat soluble vitamins if there is fat malabsorption, especially in biliary obstruction conditions. There will be fat malabsorption in these cases. So obviously deficiency of fat soluble vitamins can be seen. Deficiencies can actually assessed by various biochemical assessments. So we know what are the vitamins that have been deficient. So how do we actually know which vitamin is deficient? This can be done by help of biochemical assays which are usually present for that particular vitamin. Okay, so now let us see avitaminosis of fat soluble vitamins. Now in fat soluble vitamins, now let's come to vitamin A, also called as retinol. This avitaminosis of vitamin A is usually the most common cause of irreversible blindness, especially in younger adults. Younger children, especially in younger children, there will be irreversible blindness. Why in children? Why not in adults? Because adults usually are less encountered with this avitaminosis related irreversible blindness, because in adults liver stores vitamin A for longer period of time. Until this liver stores are also depleted, then only we can see more symptomatic vitamin A deficiencies in these patients. What happens in early deficiency? If the deficiency occurs, the early stages of deficiency, there will be impaired adaptation to dark. So that is nothing but night blindness. There will be xerophthalmia, dryness of eyes. This xerophthalmia, what happens is you can see Bitot spots, which is characteristic of vitamin A. There will be white keratotic spots on the sclera of the eye. This is nothing but Bitot spot. And we also have keratomalacia. Corneal ulcerations can be seen, scarring can be seen. This can lead to irreversible blindness. So this is a picture which is actually showing Bitot spot on the, we can see the Bitot spot onto the edge, onto the right side of the sclera. Irregular patchy region can be seen in this picture. Now vitamin A deficiency is usually, in most of the times it is usually endemic, can be seen in pregnant women. Hence eat dark green leafy vegetables and yellow fruits. In these patients they advise them to have dark green leafy vegetables and yellow fruits. Oral doses of 60 gram retinol palmitate to preschool students. WHO has recommended preventive measures for xerophthalmia in areas which are endemic with vitamin A deficiencies. They are advised to take oral doses of 60 milligrams of retinol palmitate, especially in preschool students. There is something called as overdose of vitamin A. As we already seen, this vitamin A is fat soluble, so they can be easily reserved within the liver and also in the fat. What happens is there will be liver damage, there can be teratogenicity, there can be risk. In this case, what happens is there will be hyperostosis. So, in patients who have risk of osteoporosis, always try to avoid vitamin A because of this condition. Patients are usually having hyperostosis in vitamin A overdose. Sometimes there can be acute overdose, accidental intake of bulk of vitamin A tablets. Something like this can lead to nausea, headache, intracranial pressure and desquamation. This can be seen in case of acute overdose or drug poisoning. Hyperkeratinosis is one of the condition which is usually seen with case of overdose of vitamin A. Now let us go to vitamin D. Vitamin D is another important essential micronutrient or essential vitamin which is also important for the bone strength. Okay, it is also, vitamin D is also called as one of the hormone because it is more essential to the body. Okay, this vitamin D main source is exposure to sunlight and foods which are containing vitamin D such as milk containing products are very rich in vitamin D again. These are essential for calcium metabolism, for bone mineralization, for tissue differentiation and for immune and muscle function. So vitamin D is again useful in case of immunity. Now recommended dietary intake, when proper dietary intake is being taken for vitamin D, this will prevent rickets and osteomalacia. Rickets is one of the most commonly seen in children of younger age group of vitamin D deficiency, and vitamin D deficiency in adults can manifest as osteomalacia. How this vitamin D metabolism happens? Initially what happens is, one thing, the food we take, intake of food which is rich in vitamin D or vitamin D that has been ingested through food is being absorbed by the blood and is being carried through the by the intestine and is carried to the liver and it is stored there. And sun, what it does this, the skin has vitamin D which is manufactured in the skin after absorption to the sunlight. Even this also we can will be taken to the liver again. In the liver what happens is, this in the liver vitamin D actually converts into 25-hydroxy-D. This is nothing but calcidiol. This is a primary form of vitamin D. From the liver, this will again enter into kidneys where this vitamin D, that is calcidiol 25-hydroxy-D, will be converted into 1,25-dihydroxy-D. This is called as calcitriol. It is actually the biologically active form of vitamin D. When this vitamin D is present in adequate amounts, it will actually help in absorption of calcium from intestine again. So calcium reabsorption from the kidneys and rebuilding the bone tissue. So this is how vitamin D will be helpful in homeostasis of calcium also, even in absorption of calcium also. So this is all about the metabolism of vitamin D. It is about the production of vitamin D within the body. This is a picture which is showing rickets. In rickets what happens, we can see bow legs and these bow legs are called as genu varum. Okay, there is something called as knock knees. Knock knees is nothing but genu valgum. Okay, it is genu valgum, knock knees, and genu varum is seen in rickets. In this they can see stunted growth and bowing of legs can be seen in these cases. Okay. Now coming to vitamin E. Vitamin E deficiency is usually rare, seen in cases of premature infants and malabsorption conditions. Okay, mild hemolytic anemia, ataxia can be seen, scleromas can be seen in case of vitamin E deficiency. Vitamin E is, overdose of vitamin E also is very rare because overdose can occur only after overdose symptoms can occur only after 1000 times greater than the normal dose. If the dose is 1000 times greater than the normal dose, only then it can show up by overdose symptoms. Hence it is safe up to 3200 milligrams per day. Okay, 3.2 milligrams per day is enough, but then even you take 3200 milligrams per day also, it is safe. So overdose of vitamin E is also very less. I mean, it is not very frequent. Next, vitamin K. Vitamin K is again of two types, vitamin K1 and K2. K1 is phylloquinone and K2 is menaquinone. And it is usually synthesized by colon, in a colon bacteria. It is been synthesized in colon by bacteria. Usually this deficiency of vitamin K is also called as anticoagulant factor. It's one of the anticoagulant factors. This vitamin K anticoagulant vitamin. Okay, this deficiency of this vitamin K can lead to delayed clotting and bleeding. And in newborn, it will helpful. This vitamin K is very essential in preventing any hemorrhagic diseases. So these are about Avitaminosis of various fat-soluble vitamins. Now let us enter into various water-soluble vitamins. So to start with, let us start with B-complex vitamins. And the first among the B-complex vitamin is vitamin B1, which is nothing but thiamine. Thiamine deficiency usually it does not allow metabolism glucose aerobically in cells to generate any energy. Thiamine deficiency can be seen in when patients are taking rice, which is usually over polished. Okay, in over polished rice can lead to thiamine deficiency. Neuronal cells are very vulnerable in case of thiamine if there is deficiency of thiamine. Due to impaired glucose oxidation, there will be vasodilation and also increased cardiac output in these cases with thiamine deficiency. Normally, this thiamine deficiency is usually seen in chronic alcoholics in poor diet, which is less in vitamin B1. In case of any impaired absorption, if B1 is not properly absorbed, though intake is proper, increased requirement, especially in pregnancy and growth periods, in storage and phosphorylation also can result in thiamine deficiency. Actually, thiamine is not stored in high quantities in the body. It is usually a very limited stores of thiamine. Body has usually very limited stores of thiamine. This deficiency of thiamine can lead to a condition called as beriberi, and this beriberi is again of two types, which is wet beriberi of cardiac beriberi and dry beriberi, which is nothing but neurological beriberi. Now coming to wet beriberi, it is usually a generalized edema. It is characterized by generalized edema, biventricular heart failure with pulmonary condition. Hence, as the symptoms all of wet beriberi are more related to cardiac, wet beriberi is also called as cardiac beriberi. There will be generalized edema, biventricular heart failure with pulmonary congestion. Next is dry beriberi. Dry beriberi is more related to neurological condition. Here we can see chronic peripheral neuropathy, wrist and foot drop. There will be foot drop, wrist drop like this, and as in the picture there can be foot drop. Even at rest position, even when we are trying to put your fingers or hands like this, there will be automatic drop like this. This is because of a dry beriberi condition. We also have Korsakoff psychosis. Wernicke's encephalopathy is also one of the characteristic feature of dry beriberi. Normally, this dry beriberi can be treated with multivitamin therapy. Not just vitamin B1 will be helpful in this. Multivitamin therapy is usually essential in case of dry beriberi because it encompasses whole neural system. Wernicke's encephalopathy on wet beriberi, then we have to give intravenous vitamin B along with vitamin C. In Korsakoff psychosis, it is usually irreversible, but then it does not respond to thiamine treatment much because it is a more advanced condition. There will be almost an irreversible damage done, resulting in non-responsiveness to thiamine treatment. Now coming to vitamin B2, that is nothing but riboflavin. It is usually essential in oxidation reduction reactions, that is redox reactions. Usually riboflavin deficiency is also very rare. However, if there is deficiency of riboflavin, it can result in angular cheilitis, glossitis, especially burning sensation of mouth, tongue, ulcerations in the mouth, angular stomatitis as we discussed, chelosis can be seen, nasolabial facial dysesthesia can be seen in these cases. Okay, oral riboflavin of 10 milligrams daily can be helpful in elevating these conditions. Okay, the patients will have rapid recovery by giving this riboflavin 10 milligrams. Usually the lesions which are oral ulcers that are being because of vitamin deficiency or riboflavin can mimic even after stomatitis also. Now coming to niacin, that is vitamin B3. Deficiency of vitamin B3 can result in pellagra. The characteristic feature of this deficient Avitaminosis B3 is pellagra. In this condition, what happens is normally it was thought that in this condition occurs in poor people who are basically on maize only, a staple diet of maize. Okay, and it is usually seen in deficient in case of chronic alcoholics, even chronic small intestine diseases. It will be decreased intake of this B3. B3 deficiency starts usually very fast, even within 8 weeks of deficiency. That is, if patient is not taking proper food for 8 weeks of time, we can see this vitamin B3 deficiency. So this picture is about pellagra, where we can see dermatitis completely over the skin, and patient has surrounding the neck also it is seen. Usually these pairs a facial region, and one of the characteristic feature of pellagra is again Castle's neck, which will actually have a appearance of Castle's neck. There is something called as Hartnupp's disease, which is usually a genetical condition where there will be impaired absorption of tryptophan. So in this condition also, we can see deficiency of vitamin, deficiency of vitamin B3. Now coming to pellagra, this is again a disease of 3 Ds, usually called as, it is a triad of 3 Ds. It is dementia, diarrhea and dermatitis. These 3 conditions are usually seen. Pellagra is usually characterized with these 3 conditions. So coming to dermatitis, what is this dermatitis in case of pellagra? There will be erythema, which actually resembles a severe sunburn. There will be symmetric exposure over the sun exposed regions, but not on face. Even face is also sun exposed, but then we will not see much of dermatitis on the face, and they have a characteristic appearance of cat's necklace around the neck. These skin lesions usually have vesiculation, they will have cracking, they will have exudation, and secondary infection can be seen in case of this dermatitis. Now coming to diarrhea, in these conditions it is usually associated with anorexia, there will be nausea, there will be glossitis and dysphagia also associated in these cases. These patients is usually because of this diarrhea is a non-inflammatory inflammation of GIT. There is nothing related to any inflammatory cause, but it is a non-inflammatory inflammation of GIT resulting in diarrhea. In severe deficiency of this vitamin B3, there will be something called dementia. Patient usually forgets, okay? And in acute cases, there will be delirium, and in chronic cases, we can see this dementia. Coming to management of this vitamin B3 deficiency, nicotinamide 100 mg thrice daily, which is orally and parenterally, will be rapid response. But there is something called toxicity also, but this is reversible hypotoxicity. If it is greater than 200 mg per day, there will be vasodilatory symptoms also, where flushing and hypotension can be seen. Now coming to vitamin B6 deficiency, also called as pyridoxine. This pyridoxine deficiency is usually rare. Drug-related vitamin B6 deficiency can be seen in cases of isoniazid and penicillamide. And isoniazid-induced peripheral neuropathy and sideroblastic anemia can also be seen in these cases along with vitamin B6 deficiency. What happens is when large doses of this vitamin B6 are given, they gives an anti-emetic effect, especially in radiotherapy induced nausea. So it is also helpful in cases of patients who are undergoing radiotherapy. Normally this B6 is usually nausea in pregnancy, in premenstrual syndrome and carpal tunnel syndrome. So this is a picture which is showing vitamin B6 deficiency, where we can see dermatitis, erythema over the nasolabial fold. We can also see glossitis in this condition. Now coming to biotin. Biotin deficiency is again most commonly because of consuming raw eggs, because iodine is present in it, and in case of long-term parenteral nutrition, and patient is not taking any food by mouth, NBM, and he is on long-term parenteral nutrition also, we can see deficiency of biotin. In biotin deficiency, most common symptoms are scaly dermatitis. Skin is most commonly affected. There will be alopecia and paresthesia. Biotin deficiency can lead to dermatitis, alopecia and paresthesia. Now coming to folate, also called as folic acid. Normally folate deficiency is most commonly associated with birth defects, okay, spina bifida, anencephaly and encephalocele. In these cases, what happens is the mother prenatally is advised to take 5 mg folic acid daily, even before 3 months of planning for pregnancy. Folate, the richest source of folate is liver and leafy vegetables. Folate deficiency can lead to heart diseases, dementia and even cancer. This is a picture showing anencephaly, and this is a picture we can see where there will be open defect, that is spina bifida. Now coming to hydroxycobalamin, which is vitamin B12. Vitamin B12 is usually very important or essential in nerve myelination, and it is also a cofactor in folate coenzyme recycling. It is usually essential in DNA synthesis in RBC. Remember, vitamin B12 deficiency, as we have seen, vitamin B12 is useful both in neurologic and also in hematologic. So this deficiency will lead to both hematological manifestations and neurological manifestations. Neurological manifestations most commonly are the nerve demyelination, and deficiency can lead to hemolytic anemias like macrocytic or megaloblastic anemias. Vitamin B12, hence in this case what happens is not folate, B12 is usually essential in myelin integrity in this cases, not folate, okay. Now coming to neurologic consequences, there will be severe deficiency leading to severe diffuse insidious uneven demyelination. and peripheral neuropathy is seen in these cases. In these cases, we can also see spinal cord degeneration, both anterior and posterior columns, and cerebral manifestations are also seen in these cases, which actually resembles dementia. Optic atrophy is also one of the common symptoms which can be associated with this vitamin B12. Now coming to vitamin C, that is ascorbic acid. As we all know, vitamin C is very essential in case of maintaining the collagen integrity. It is essential for intracellular electron transfer, hydroxylation of proline and lysine in protocollage. This deficiency of vitamin C is usually due to improper cooking, okay, the cooking methods, and heat. It is very labile. Vitamin C is labile, especially when it is exposed to heat and increased pH and light. High vitamin C dosage can provide immunity also, okay. And scurvy is a condition where there will be, because of deficiency of vitamin C, excessive deficiency of vitamin C, especially less than 10 mg per day. In this case, what happens is there will be defective formation of collagen, impaired wound healing, capillary hemorrhage, decreased platelet adhesion. Gums are usually swollen, they are friable and easily bleeding and bruisable. Perifollicular and petechial hemorrhage can be seen in these cases. We will see ecchymosis, hemarthrosis, anemia and GI bleeding in these cases where there will be deficiency in vitamin C. So how to manage this deficiency of vitamin C? By giving oral vitamin C of 250 mg thrice daily, we can help in decreasing the symptoms of vitamin C associated deficiencies. Diet has to be corrected, cooking methods have to be corrected. Giving greater than 1 gram per day can lead to diarrhea and renal oxalate stones can be seen in these cases. So this is about a whole of vitaminosis, which is a brief discussion about Avitaminosis related to both fat soluble and water soluble vitamins. Not just knowing the effects of vitamins, that is uses of vitamins, we should also know the ill effects of vitamins. Hence we have also included overdoses of various vitamins, and hope this will be helpful in prescribing vitamins to the patients and also in maintaining a balanced diet for the patients. Thank you.